for the COVID-19 fight here in the state of Florida. Our probably top priority from when this all began was to protect and safeguard the elderly, given the way that this virus impacts specifically their health. And we've directed really from the beginning that you're going to be safer at home, and we urge all Floridians age 65 plus and those with significant underlying medical conditions, to stay at home during this time where we're fighting the virus. Obviously, if you need to get medicine, food, what have you, but you're safer at home, and we want you to come out of this thing on the other side strong and intact. We've also been very focused on protecting nursing homes and assisted living facilities. We did impose a visitation restriction for all visitors to nursing homes. That is for their safety, given that we don't know who may be carrying the virus. Now, as you have the advent of some of this rapid testing, that does allow us to be able to test people before they go into a nursing home, not only staff, but you could have some family members as well. So that is all in progress, but right now, we got to keep those folks safe there. And so what the Agency for Healthcare Administration has done is they've made over 907 on-site visits and over 2,000 calls to long-term care facilities to evaluate adherence to infection prevention protocols. And so it's very, very important. If you look at the fatalities in the state of Florida, I think the average age is between 75 and 80 years old. And so the senior citizens are going to be safer at home. And then also if you have an underlying condition, regardless of age, you're going to be safer at home as well. So please heed that guidance. Another priority for us has been to expand testing in the state of Florida. We started this process. There was really very little testing available. Everything had to be done through the CDC. That obviously was inadequate. And so over the last several weeks, it's been the state's, one of the state's top priorities to expand testing in the state of Florida. And, I'm happy to report we are increasing testing at a very fast rate. Today's numbers, I think we're over 60,000 tests, and most of those are over the last 2.5 weeks. But I think it's also interesting to note as you look at the number of new cases that come down the pike in the various states. That obviously is an important thing to look at, and we obviously monitor that very closely in the state of Florida. But it's also interesting and important to look at the number of new cases against the number of negative test results that you've seen. And so these numbers that we have on the screen are from yesterday, just because we didn't have all the other states' updated numbers. Obviously, our numbers have changed for today, and you guys have seen that report. But if you look, Massachusetts and Florida had about the same number of positives, Massachusetts a little more, but Florida had, about 13,000 more negative test results. You go down and look at a state like Michigan that had more positives than Florida, but Florida had 50,000 negatives, Michigan only had 12,000 negatives. And I think you look at that, so we are now at the point where Florida, and then California is interesting because they have 7,400 positives, only 21,000 negatives. So we have more than twice as many negatives as California. I think part of the reason is they have about 50, 60,000 tests that are, quote, pending. But we have expanded testing dramatically in the state of Florida. I think if you don't count California's pending results, I think we're just behind Washington State and obviously the state of New York. If California dumps those pending tests, then they would be ahead of us. But from where we started to where we went, that's taken a lot of hard work, and a lot of it is because we've set up testing sites with the Florida National Guard in the lead, things like the site with Broward Memorial. You had 700-800 people going through those drive-through testing sites every day. Those are not easy to run. Most of them that have been done throughout the country have failed. We have the Guard working with the local communities, local hospital systems, and we've been able to get many more people tested as a result of that. We are opening today the Palm Beach testing site, so that's going to be in West Palm where the baseball facilities are for the Astros and the Nationals, and that is a facility that we think can be very high volume as well, so we're excited about that. Of course, we do have the Broward facility still running. We have the facility at the Marlins Park in Miami-Dade have the drive-through facility at Hard Rock Stadium in Miami-Dade, and now we're surging supplies for a testing site in Hialeah, and we're surging supplies for a testing site in South Miami-Dade. So those are going to be coming online very soon. We're also going to be pushing down supplies and assisting with an additional testing site in southern Palm Beach County, and we're looking forward to doing that. And as many of you know, there's been a site in Jacksonville up now for a while, it seems, Orange County in Central Florida, and then we have been supporting the drive-through site at Raymond James Stadium that Tampa is running. You have Tampa General, Baycare, some of those health systems involved. I think the city's involved. So we've been supporting that, and we're happy to do so. So if you look at, we're over 60,000 tests. We're doing thousands and thousands every day. We're going to have some new technology come online very soon. We think we can continue doing this. Why is that important? South Korea is usually pointed to the country that they just did a whole bunch of testing. They were able to figure out, where exactly the virus was spreading, focus on those areas, and then they were able to have more freedom of movement in the rest of society. Their testing rate, they got, I think, a little bit better, but the key marker that people would put at is 1 test for every 200 people in the country. In the state of Florida, if we get over 100,000 tests done, that will be about 1 test for every 200 people in the state of Florida. And so we would be, obviously Florida's a lot smaller than South Korea population-wise, but we will be getting to that number, and that's something that we're really looking to do. And as you see, the number of tests per day that we've done has gone up dramatically, and we want to continue to doing that. And so I just want to thank the folks at the National Guard. I want to thank the hospitals. I want to thank the local governments who've partnered with us. This was really, we had to grab ourselves by the bootstraps. I mean, some of the other areas that have tested a lot, you got a lot of federal supplies that really flow freely there. I mean, we've gotten some help, but a lot of this we really had to do on our own. So I want to thank them for doing that. And I think that one of the reasons we've been able to get some data on the trends in places like Southeast Florida is because you've increased testing so much, and we're going to continue to do that. I think it's very, very important. With these tests, we're having now these rapid tests, and that is going to come online. First of all, we have the 45-minute test. That's been deployed in southern Florida and in northeast Florida, 45-minute rapid test. That's a perfect thing to do for healthcare workers, because if someone gets exposed, you can test them. If they're negative, then they don't have to necessarily self-isolate, and that's very, very important. We also expect that hospital systems very soon will be getting this 5-minute test from Abbott Laboratories. And so the way they're going to do it at Abbott is they're just going to send it to various hospital systems throughout the state of Florida, and then they'll continue to send them additional tests every week. So we anticipate each hospital system, we think, is going to get about 2,000 tests per hospital. So this is going to be spread out. So that's going to be a lot of additional testing, and the data that we're going to get back from that is going to be very quick, and that's really going to help us identify some of the things that are going on in the state of Florida. One of the things we're seeking, and we may ask one of the hospitals to help, is, an Abbott lab test is perfect to do some spot checking of these nursing homes or assisted living facilities. And if you're able to do that, you really don't even need to test everyone. If you test a representative sample, you can see whether there's anything there. And if you do see anything, then you test everyone. So I think that there's ways to do it which would really make sense. So I'm asking folks at the Department of Health, Emergency Management, to try to get some of those rapid tests so we can use them in nursing facilities and in assisted living facilities. And that will also be great to test the staff. I mean, the problem in the Broward situation was you had 6 staff going in there, and these were people that shouldn't have been allowed to go in there. Here, you can just test, and if you're fine, then you work. If you're not, then you can't go in there. So, but we're really happy that this is going to get turned around relatively quickly. So we anticipate this to start landing in Florida probably within the next week. And I think that this will be an absolute game changer. We also have we've got a lot of the hydroxychloroquine that's now been delivered to a lot of these hospitals. And again, the FDA just came out with the emergency approval. Look, this is kind of anecdotal, but you see more and more people using it. Bottom line is we just want physicians and patients to be able to have that as available, and if the physician thinks that that's something that's good, we want to be able to do, but we were really glad to work with Teva Pharmaceuticals on that. And I'll talk about the hospital space, but when you're talking about the hospital beds and PPE, stopping those elective surgeries, you've seen beds being added and you've seen PPE being conserved, and so that's a very, very important thing for our folks working in the healthcare industry. We have sent a lot of supplies. Now, we're fighting for this every day. It's really cutthroat in terms of these masks, and 3M will make a bunch of them, but then they'll give them to this district, and there's this whole kabuki game that goes on, but it's probably the number one logistical priority that we have is getting more PPE, but we've been able, fortunately, to allocate a huge number of masks, including almost 60,000 masks, N95 masks to nursing homes, and then 140,000 procedure masks to nursing homes. We think that the staff needs to be wearing the mask if they're going to be around any of the elderly residents, and so we think that that's something that was good, and we hope that they'll be able to use that. But we're continuing to fight for more PPE. We've ordered, right off the bat, we ordered millions of masks, but this stuff gets put around and there's a lot of tomfoolery going on, so we're continuing the fight on that. But all told, you're looking at about 600,000 N95 masks that have been delivered to various counties and hospital systems in the state of Florida. It's important, and we want to continue supporting any way we can. Southeast Florida. I think if you look at the numbers, they're obviously pretty stark in terms of you got about 60% of the cases in the state of Florida that are in Southeast Florida, Miami-Dade, Broward, Palm Beach, Monroe, not as many, but they're part of the family too. We've been working with them from the start, working with the local mayors, working with some of the things they've been doing, and they've been doing a lot right at the beginning. Mayor Jimenez, folks in Broward and Palm Beach. Yesterday we got everyone on the same page to do the Safer at Home South Florida order. If you look at South Florida, you have the most densely populated part of the state. And the way the virus has kind of come into Florida is, I think, kind of three main ways. One is we have Floridians that travel internationally and then come back, and a lot of them didn't know that didn't really know much about the virus. It's not their fault. We have international travelers come to Florida, of course, and Miami is a big destination for that. And then you have Floridians that will go and spend time in New York City and come back, and then we have people from New York that come down to Florida. Of course, the exodus that we've seen, that we've been working on, but even before that, that's just a normal part of life in southern Florida to have that back and forth with the New York City area. So that's kind of how this has been seeded in that part of the state. And if you look, certainly Broward and Dade and Palm Beach, you look at those numbers, so we're basically trying to do whatever we can to be able to slow down those numbers. I do think that Miami in particular, there was just such a dearth of testing there. I don't think anyone even tested positive in Miami until there were some more rural counties, I think, that even had someone test positive. And so, that was kind of a function of the criteria. CDC said you had to come from China or visit China, when in fact of the matter is, as we got into February, this thing was circulating. I think it was circulating during the Super Bowl. And so as you've been able to get more testing in Miami, you've been able to identify cases. Their rate of positive is a lot higher than statewide. Broward has pretty consistently been about 10% of all the symptomatic people test positive. Dade is much higher than that. I think they're between 15 and 20% of the people who have symptoms test positive. And so that's an indication, that you have a wider spread. So we're looking at that. We do, though, notice that the demographic spread in places like Miami skew a little younger. than what we had seen. And I think actually all our information is starting to skew a little younger, because I think a lot of the seniors have heeded the message about being safer at home. When we first started this, we had very limited data, but I mean, it really skewed 65 and plus much more significantly than it does now. The Dade and Broward, or Dade in particular, you're starting to see more of that 25 to 55, and doesn't mean there can't be any complications there, but if you look at the fatalities, they're overwhelmingly 65 plus. So that's something else that we're looking at. But basically, all 4 Southeast Florida counties are united. We're supporting them. We've put a lot of supplies down there. We're going to continue to do that, and we're happy that we have the Palm Beach testing site there today. And we have been able to do a lot of the monitoring of people coming in from the New York City area. We've done thousands and thousands of those. Look, our hope is that they will be safer at home, just like everybody else in Southeast Florida, and not potentially spread the virus. So it's very, very important that you do that. So we're going to keep working with the folks down in Southeast Florida. I know there's this issue with these cruise ships, and I've been in touch with the White House about it, the Coast Guard about it. The way to deal with this is to send medical attention to the ships. To be bringing people into the state of Florida, I think most of these are foreign nationals. That's using up some of our resources here that we need to have available for Floridians. And so, I've asked the White House to work on getting medical supplies there, and I think the cruise ship should be, responsible for helping facilitate that. But just to drop people off at the place where, we're having the highest number of cases right now, just doesn't make a whole lot of sense. I'll talk about the hospital. The hospital situation looks really good right now, but obviously, we're preparing for that to change, and it could change any given day. As most of you know, we've been testing a lot more and seeing that. So the hospital bed availability. So right at the beginning, protecting the seniors, expanding the testing, and then protecting the healthcare workforce, but then also supporting the healthcare system, and that is the capacity. I mean, the whole idea of flattening the curve is so the healthcare system can absorb the infections and the people that require medical attention. The virus kind of, it's eventually gonna do what it's gonna do, but if you can shift that and suppress it, then you're going to have the healthcare system be able to handle it. So we track on a daily basis the availability of beds. So you can see statewide, we're close to 37%. Dade, we're about 41%. In Broward, we're 45%. Of course, you look at the ICU beds as well on that. This is just something that we monitor every day. I think the stopping the elected surgeries has opened up more beds, and I think that you've had fewer complications from things like influenza, even though we're kind of at the end of that season. But I think over the last couple of weeks, because I do think people have changed how they interact with others. I don't think you see shaking hands as much. I think people do keep their distance. So you have seen a decline in that, and hopefully that portends well for the fight against COVID-19. As we know, the chance of having a negative outcome in terms of a hospitalization or a fatality dramatically increases the older you get. And regardless of age, almost every fatality has had a serious underlying health condition. And I asked the health department to start putting how many of the fatalities did have that, because I know a lot of people are asking about that, so we are working on that. And of the 77 deaths, you've had 23 that have been in Broward and Palm Beach counties. I've mentioned, I think before, this is a picture of the field, one of the field hospitals. We have one in Fort Lauderdale, one in Miami-Dade. And of course, we have identified other buildings that if there is a need to do that and have excessive beds where people can go, you're going to be able to do that. We're also in touch with the Army Corps and FEMA about what's going on with, or having them look at, they've already been down here, they've looked at different things, and so if there's a need to have a surge capacity, we're going to have the Army Corps help us out as well. But as soon as this started, we kind of knew where this may be necessary, and so we procured it. This was not done by the federal government, it was all done by the state government, and I think that was good planning by Jared and the folks at DEM. And then just an update on the travel. We've screened between the state line cars and then the flights, about 8,600 people. And again, this is just people coming from the hot zones. They are when this was flaring up in China, there was monitoring of anybody that came back to Florida who had been in China. When it flared up in Italy, monitored the people who came back from Italy as well. So New York City being the epicenter in the world, same situation, just trying to keep Floridians safe and urging and requiring actually those folks to self-isolate for 14 days. So I think that there's, and we're going to be watching the President's news conference today. I've been in touch with some of the task force members earlier. They're going to update, I think, these guidelines, and basically, we're going to follow the guidelines. And so, whatever they're recommending, we'll go ahead and do that. And so I may take their guidelines, kind of create a streamlined version of what we've already done, but put it in there, add whatever needs to be added, and then send that out. But I think that there's been a lot of Floridians who've been working very, very hard, and I just want to thank them. I want to thank all the folks on the front lines in the healthcare industry, at our hospitals, our nurses, our doctors. They're working hard, and I think they're doing a great job. So let's just keep fighting. But I think that if we all do our part, I think we're going to be able to. I think we'll be able to get through this. And with that, take some questions.
We're hearing that the number of nurses are either having their hours reduced or they're being furloughed as a result of the order on elective surgeries. There just aren't patients there. What guidance would you give hospitals given the fact that there may be a surge in visits as this disease continues?
Well, you're right. So look, I totally get it. I mean, and that's one of the problems with doing the elective surgery suspension is that the surgeries are typically how a lot of these medical outfits, are able to keep the lights on. So it's unfortunate, but I think that we want to make sure that folks are going to be able to be there, in the event of a surge. And so if there are folks who can be brought to the fight, we have hired a lot of contract nurses through the Department of Emergency Management. If there's a need in the hospitals for more folks, we want people to be able to go in there and work. I think it's very, very important. When you look at the healthcare workers, the danger is, first of all, this stuff, when you're in these hospitals, you're going to get exposed one way or another. Hopefully you don't get infected, but it's really difficult to do your job even with the PPE. I mean, it's just tough. So there's going to be times when people get exposed. If you have a quick test, that's great. If you don't have that, then all the contacts have to self-isolate. You can lose a lot of the staff, and that's a very, very difficult thing. So anybody who would be willing to pitch in, either on a volunteer or contract basis, I think that they should do so. We have brought in a lot of contract folks, but if there's a need for more, we'll certainly do more.
Yeah, Governor, the scientist side of the White House spoke with Surgeon General Rickey yesterday advising Florida shutdown. Is the Surgeon General still, or is he recommending to you that the state not shut down?
Who recommended that?
That was a scientist sent by the White House. I don't want his name in front of me. Yeah, that's it.
Who?
Dr. Alan Mockdad, he was part of the study that the president cited in the Lewis Group.
So I'm in contact with them, and basically, I've said, are you guys recommending this? The task force has not recommended that to me. If they do, obviously that would be something that would carry a lot of weight with me. We have done, really, and this has been going on for 2 weeks because, we're working with the Southeast Florida counties, there's not really any more you can do in Southeast Florida. You just got to kind of stay the course at this point. Some of the other areas, it's just a different situation. We're a big, diverse state. If you look at New York State, obviously New York City, surrounding areas, some of the other places, they're just in a different situation. But I look forward to the guidelines. We're obviously going to take whatever they say, and we're going to implement that in Florida. And if any of those task force folks, tell me that that we should do X, Y, or Z, of course we're going to consider it. But nobody has said that to me thus far.
I'm sure you've heard them, or you've heard the chatter about.
Well, first of all, we've gone through the testing numbers. I think they speak for themselves in terms of we're over 60,000 tests. We're doing thousands and thousands of tests a day. If we get over 100,000, given our population, that'll be about 1 in 200 people, which was considered the gold standard with South Korea. It's been a #1 priority for us. And the idea that there wasn't testing originally wasn't because of us. If I had the ability to do it, we would have done it. We were in kind of a different environment with the CDC regulations and what they wanted to do. We've broke through that, and we are testing, and we're going to continue to do it. We've set up probably more drive-through sites than just about anybody. Some of these sites are putting through 700, 800 people a day, and turning this stuff around. So we're going to continue to do it for sure. But part of the reason why, because we've tested so much, that's part of the reason we've been able to identify these things. I mean, you look at some of these other states, Michigan, they had more positives than us. They only had 12,000 negative. We had 50,000 negative based on yesterday's numbers. So as you test more, you're going to identify more. And I've talked about Dade and kind of how we're viewing that. The Palm Beach site, I think, is going to be very important. Palm Beach has had testing, but I think they need more. So we thought that was a priority to send that to them.
Governor, I would follow up on what Laura said. It seems like you're saying that you're waiting for a signal from the task force, that you're really waiting for them to make a recommendation.
No, I'm not saying that. I'm just saying, we're kind of going, he's asked, has anyone recommended to me, in an official, and it's, one thing for like a talking head or someone to do, but it's, someone in the official thing. So we'll, anytime, someone in this process, says something, I mean, I obviously consider it. I mean, I think you got to.
Governor, when you've been speaking about priorities, you said very little yet about the unemployment compensation system, and today there was another call for a statewide order for you to issue to ban evictions in this state. What about the economic upheaval?
Well, we've been talking about the unemployment a lot. I mean, as soon as this started happening, I told Ken Lawson, Department of Economic Opportunity, expand the capabilities. He's been working to hire as many people to help process claims. We knew that this was going to be something that was going to be really, really bad. It's going to hit Florida especially bad because, I mean, Disney World is closed. All these things are closed, and that's going to throw a lot of people into upheaval. But that's something that I consider in all of this, because some of these things, when businesses are closing, there's going to be some parts of the state where if it closes for a month, it just ain't coming back. And it's going to be very difficult for a lot of people. So I've been mindful of the second and third order effects of some of these things, which is why I've tried to tailor the approach to see, where the fight was in terms of, the virus had taken hold, where it was really spreading throughout the community, but trying not to be as ham-handed, because I just feared that, if you do that in an area that already has a lot of tools, has the ability to test, has all these other really stringent mitigation things that we have statewide. I mean, that's never been done, in modern Florida history before. So those are things. So I think it's a huge, huge problem. We're going to work as fast as we can on it, but it is not going to be something that is going to happen where we're going to be able to field and process these things overnight, just simply because of the magnitude of it. It is orders of magnitude above what the financial crisis did, and that obviously hurt the state a lot because you had the housing bubble collapse. You had a lot of problems here in the state of Florida. One of the things I am working on is, you notice how the state is quiet. I mean, you look at the roads, there's just not a lot going on right now. And, that's understandable. But given that there's the traffic is down and everything, I'm going to be looking at accelerating some of these infrastructure projects, because when you're doing those on busy roads, it causes a lot of problems. Well, when those roads are no longer busy, if that's going to be the case for the next month, then we're going to need to make use of that time. And I think a lot of people will be here.
That you can throw out to people right now that are in between paychecks.
We're going to do the unemployment system for sure. I mean, we want to be able to get that out. This bill that just passed, we're scrutinizing that, and obviously want to be able to assist in anything that's flowing there. I authorize for the small business folks who are either out of business or are in really tough shape, bridge loans. I've been working with Senator Rubio on the small business program that they did in the bill, which I think will benefit a lot of Floridians. Those regulations are being written now on Friday, though I think they're going to be done on Friday. I mean, there's a desire to turn that around quickly, and if they do that, we definitely want to get that information out to people so that they can apply. I think that'll be much more effective than a lot of government programs because they're going to be able to go to the private sector, get the loan, federal government will back the loan, and a lot of these loans are just going to be forgiven, so that'll give people the ability to get through, a tough period.
We've been trying to confirm a tip, whether it's true or not, I don't know, but that thousands of tests in North Florida got screwed up and had to be redone. Are you aware of any problems with testing, mistakes that are being made?
Where in North Florida? At the Duval testing site?
Leon County.
Okay, I'm not aware of it. I know Leon County they did their own site early on. That was something that we were glad to see, but it wasn't anything that we were necessarily involved with, so I just can't confirm that.
Are you hearing any problems anywhere else around this?
I mean, I think the biggest problems is, you have the tests people go through, they gather up all these tests, and then they send it to a commercial lab, and there's just a nationwide crush. I mean, we went from, if you look at how many tests had been done by March 1st in this country, I bet you it wasn't even 100,000 tests. Now we just hit 1 million tests. Well, there's only a couple labs that do this, and so everyone around the country is sending it to just a handful of commercial laboratories, and what happens is you go through, you wait, and it's not a 24-hour turnaround. It's not a 48-hour, which is, well, I think their goal was 48 hours. So sometimes it'll take longer, and that's a problem. We do, with these instant tests, that's going to alleviate that, and I think that that'll be a wonderful thing. So we want to get as many of those instant tests as we can. We now are able, I mean, we've pushed out supplies for the traditional drive-through testing. We have the ability to do tens of thousands more of those. As soon as we get the Abbott test, now that'll be mostly done through the hospitals, but that'll really be a game changer, and so we're looking forward to that.
There are many indicators in the Florida prison system that 12 a dozen Florida prison employees have tested positive for coronavirus, and there's worry that there's not enough supplies to protect staff, and the testing is not happening fast enough for inmates and staff. Is there anything your organization is doing to ensure?
If they need supplies, I mean, they should talk to, I'll tell General Lynch to talk to Jared at DEM. I mean, we do have the ability to provide some protective equipment for sure, and there are tests available. I mean, until we get the rapid test, I can't guarantee you're going to get it turned around immediately, but there are tests available, and we've not only pushed out the test to all these sites, we're replenishing all the county health departments as well.
Governor, what is your message for those that are, state leaders held a virtual press conference this morning asking for a statewide eviction moratorium? What is your message for those that are coming up short for their rent?
So we're looking at that. I know the president had talked about doing it, so we're trying to see what they did federally. Obviously, this is you're not going to be able to rent out a place right now, so I think it makes sense. So we're looking at it and see what we see what we have to do.
Number of cases doubling, every few days, and yet, there's different places in the state where, St. Johns County beaches, where they closed. You're seeing other reports in the state where, there's still large gatherings that are happening. Do you think that your approach of leaving it up to local jurisdictions to make these decisions are hindering your efforts to...
So here's the thing, I don't have an enforcement arm here. Anything has got to be done by the locals anyway, so I could say this or that. I mean, the Southeast Florida folks asked me to do, to close their beaches, so we did in one of our earlier orders. I was flying out of Miami yesterday, looking at the coast. Guess what? Closed beach. Were there people out there? You damn right there were. So it's just like a water balloon. Restrictions here, people go, you can do this, you got to do this. So there's a group of people that are going to just kind of pop around, and it's really up to the locals to deal with them one way or another. So yeah, I think our guidance is no groups of 10 or more. Follow what the CDC said. I think that's the best way to be safe, and I think if people do that, they're good. But I mean, you see this in New York City. Huge crowds that they're doing, and they had greeted the ship. There were hundreds of people there. When California did their stay-at-home, Southern California, they're just packing on the beaches. So that's just the reality that we're dealing with, that not everybody believes that they need to, to govern themselves accordingly. But yeah, I would urge everybody to just take a step back and realize that, when we get on the other side of this, there's going to be times to have a big party in someone's house or do this or that. Now's the time to avoid crowds, take care of yourself, take the social distancing seriously, and I think if you do that, then we're going to be able to get back to normal much quicker. If you're disregarding that, then. But the bottom line is, you are going to have people who are going to be doing this. We've seen that in every state in the country. We're a very big state. As much as I don't want to see that, and I know the locals are going to have to just police as best they can, but I think that, we really are focused on getting all this stuff to people, testing, do all that, because that will make a difference, and it's just unfortunate. But I think no matter what you do, you're going to have a class of folks who just are going to do whatever the hell they want to.
We're getting calls from people who live north of the four stay-at-home counties, worried that those folks will do what the New Yorkers did, move north and move up to places where it's safe.
So here's the deal. I mean, and so we'll look at that. I think it's a legitimate concern. But I mean, everything's pretty much closed. I mean, it's like there's not like there's anything to do. And so, but I do understand people just kind of want an outlet. They want to do this. So we'll look at that. We'll see how it's going. But I would say this. Those counties have been stay-at-home basically anyways. I kind of came in and just made them all one unit just so everyone was on the same page. And I'm not sure how much that had happened or not, but at the end of the day, it's I just think people need to be responsible. There's not a whole lot right now. I mean, there's certain, you can go to work and obviously in certain industries, very important you do that. But other than that, there's just really not a whole lot going on. So people should just kind of chill out and stay around the house as much as they can. And it doesn't mean like, you can't go for a walk or do some things, just get some fresh air. But in terms of being social right now, this is just not the time to have, any big social gatherings or doing anything like that. And I hope that people will respect it. I do think that there have been enough people in Florida who've just taken this thing seriously in terms of their hygiene, in terms of how they keep their distance and do that. I do think you've seen a change in the past couple weeks, and we'll see how that impacts this going forward. And I think that does really, really make a difference. And I really appreciate, because from the very beginning of this, we had enough information to see how the virus affected elderly or people who were frail. And, our stay at home, if you're 65 or plus, if you have a serious medical condition, doing that really makes a difference. If those folks continue to do that, I think many of them are. I think many of them are being very, very careful, which is the right thing to do. I mean, if they do that, then we're going to be in a situation where we will be able to get through this. And so those folks, thank you for what you're doing, because I think it's made a very big difference. And so we're going to have an announcement tomorrow on the infrastructure, but I think now's a golden time. If we're going to be kind of in a down state for the next 2 to 4 weeks or however long the guidelines go for, that is the perfect time to really accelerate on some of these busy roads. There's not going to be any traffic jams. So we're going to identify some projects and hopefully be able to make a big difference. Thank you.
Is Dr. Ripke